Well, good afternoon, Chair and members. Today I'm presenting SB 912. This is a bill that will respond to the immediate needs of foster youth and also establish the emergency protocols for foster youth during the future emergencies. The COVID-19 has created an unprecedented public health crisis and put California in a state of emergency. As we respond to and mitigate the impacts of the crisis, we cannot forget people who will suffer the most from the instability and uncertainty. Now more than ever, foster youth need our support. When a crisis happens, foster youth are usually hit the hardest. And right now, foster youth are facing isolation, and many do not have the technology to navigate remote learning or how to stay in touch with their social worker. Many are bearing the brunt of the economic downturn and have been laid off or had their hours reduced. Now, worst of all, for those turning 18 or to 21 during the crisis, they will be cut off from essential services needed to maintain housing, mental health services, and keep up with their education. Unfortunately, they are not given the necessary protections to weather the crisis, and without our support, they are left alone to deal with food and housing insecurities. We have an urgency to pass SB 912 and stabilize placements, housing, and services for foster youth and non-minor dependents during this pandemic and a future state of emergencies. The bill will provide that youth who turn 18 will be assumed into the non-minor dependency system unless they choose to opt out. It also ensures that the youth who turn 21 during the state of emergency will remain in stable placement until 6 months after the state of emergency concludes. And lastly, it closes loopholes in the current system which prevent certain youth from entering extended foster care. And I'd like to turn it over at this point to my witnesses, Madam Chair. I believe we have the Youth Law Center, Julie McCormick, and Journey Housing Advocates, Ashley Lizarraga, to speak a current foster youth. Thank you.